Well, good evening, everyone, and thank you so much for taking the time to tune in with us either live or to watch after this streamed Zoom call for my fourth annual briefing on prostate cancer with the AdMeTech Foundation. Tonight, we're joined by some of my friends and colleagues, as well as my partners in the fire service. I'm going to share with you a little bit why this is so important to me and how I started working with the AdMeTech Foundation and the amazing Dr. Stern, who's on the call tonight. But first, for some welcome remarks, I'm going to hand it over to my partner in district, Senator Brendan Creighton.
Thank you so much, Representative. Honored to be here today. Look forward to having a great conversation and to continuing to learn. We go way back with ADME and Dr. Stern, going back to my days as a staffer at the State House, and she's done such amazing work, as has the old organization, and raising awareness and certainly stressing the importance of early detection. Also honored to be here with Saugus Fire as well, with Anthony and Mario, who we look forward to hearing from. But this is a great opportunity for policymakers and community members alike to learn and to see what we could be doing better. So thank you again, Representative. Appreciate this opportunity.
Thank you so much, Senator, and thank you for always supporting the work the AdMeTech Foundation does, as well as our colleagues in the fire service. We're so grateful for that partnership. We are not joined by some of my colleagues in Revere because there is a Revere City Council meeting happening at the same time, so I'm sure they'll be streaming on later. But quick, before we turn it over to my friends from Saugus Fire, just to share with you how I got involved and why this is so deeply personal for me. 8 years ago, I lost my grandfather to prostate cancer. And as I was getting ready this morning, and I didn't think of this when we scheduled this meeting, today's actually the anniversary of his passing. So I cannot think of a more fitting way to honor his memory and his legacy than by spreading awareness and talking with Dr. Stern and the medical professionals that we're going to have on today, as well as what's super, super near and dear to my heart, my friends in the fire service, about how treatable prostate cancer is with early detection, with early screening, and with the resources that we have available. Something that I always stress on these calls is it's really important, even as women, to be aware of this, because it's often us that are pushing our husbands and fathers and grandfathers and brothers to go to their appointments. I know during COVID, many of us postponed our regular checkups and our regular doctor's visits, and now is the time that we go for those screenings. I know they're not pleasant, and I know they're not fun conversations to have. As someone that grew up with a single dad in the police department, reminding him to go to his annual doctor's appointments and do things like that were conversations that we often had in the household, just because we became hyper aware of these issues as my grandfather battled prostate cancer for many, many years. My grandmother is a breast cancer survivor. She's beat breast cancer 5 times. So to have our breast cancer awareness flag worn by Saugus Fire today, and all the incredible work, they just hosted a very successful event for breast cancer awareness. We know that these are not isolated incidents. We know that cancer is prevalent in our gateway cities and our communities. So I'm really, really excited to learn from the professionals that are on today, to hear from our fire service on how we can further support them and educate and share awareness about early detection and prevention, and also to hear about the wonderful work the AdMeTech Foundation is doing. I know, as Senator Creighton mentioned, he's had the pleasure of watching them grow for years during his time in the building, as have I, and it is really quite incredible. So without further ado, I'm going to hand it over to our team on Saugus Fire, Anthony and Mario from Saugus Local 103. Thank you, or 1003. Thank you so much for joining us. We're so grateful to have you.
Jess, thanks for having us. We appreciate it. Mara and I do a lot of work at the state level with the professional firefighters of Massachusetts, whether it's a state meeting or most recently we were out at the DCU Center in Worcester for the biannual convention. And I've been involved over the last 12, 15 years. The amount that this has grown when it comes to early detection and prevention, has been unbelievable in just my short time here. The past couple of years has kind of been a driving force within the PFFM for early detection, to the point where if you go to a convention on the PFFM or International Association level, they're offering screenings right there at the convention, which is fantastic, whether it's a blood test, or we also have the ultrasound through a diagnostic company, which is anybody in the fire service will tell you the opportunities that we have for the detection over the past few years have been unbelievable. We're so grateful to have partnerships with different companies all through the PFFM to be able to help us with this, but it's not something that they told us when we signed up for this job. You kind of take the test. Some guys younger than others. Everybody's excited. I'm going to make a difference. I'm going to be out there doing it. Then only to find out that these harmful chemicals are in our gear, drinking water, the gear that we put on to go out on calls that's supposed to protect us is actually causing just as much harm. So, and like I said, we're just learning these things over the past couple 5, 6 years that it's actually these things are harmful. So luckily here in Massachusetts, the International Association filed a bill to reduce PFAS, and it was just spearheaded here in Massachusetts, which was great, right in Boston. So we are lucky here in the Northeast that we're ahead of some of this, but when you go to these conventions and talk to these guys from across the country, they're barely getting their health insurance covered, never mind having the opportunity for early detection when it comes to some of these cancers. So here in Saugus alone, we had a deputy chief who retired in months after his retirement. He was diagnosed with prostate cancer. He was a little bit later stage, so his fight was a little bit more of a struggle than most, but he was actually at the fundraiser on Friday night playing the bagpipes, and you would have never known. So like I said, we're very lucky to be ahead of the game, and obviously the treatment around here is top notch. So we're grateful for it. It's something that's on our minds every day that we're in the station. We're making steps, and we appreciate having the support of the state delegation the whole way. I know I'm lucky, and Mario's a little bit older than me, so he's gonna be due for some testing soon. But we're grateful for it, and
I think I'm overdue. I think I'm overdue.
but we're grateful for it, and we appreciate your support along the.
Well, thank you both so much, and thank you for taking the time to be here with us tonight while you're on duty and protecting the residents of Saugus, and also protecting your brothers and sisters in Saugus Fire by talking about these important issues. So I'm so grateful for that. And something that's so important is these cancers don't always happen right away. You're not always diagnosed while you're on the job. And in my grandfather's case, it was years after he retired, because you're exposed to these harmful chemicals for decades. And one of the reasons why I got involved with the fire service and the AdMeTech Foundation and paired them together, because it's so important to my district, that connection. But also firefighters in general, we know, are disproportionately impacted by prostate cancer because of your gear, because of the chemicals and toxins that you're exposed to, and because it's a predominantly male industry. So you're going to have higher rates. And I know in my grandfather's case, when he was in the fire service, the gear was still as poisonous, but it was different, right? They didn't have turn down pants. So he was protected by high boots and a long jacket, and everything else he was exposed to. If he was wading in water that was filled with chemicals or responding to a fire, it's touching your skin, you're absorbing all those carcinogens. So really grateful to have this partnership and to help spread awareness through our connections. And I know
think there's a lot of guys here that would go back to the long coat and long boots if they could.
I'm sure. And as long as they're PFAS free, because I know that's something that we're fighting on too in the state level, to make sure that you guys have safe gear.
We're getting there. Reduce PFAS first. We're getting there.
Absolutely. And I know my friends from Revere Fire that join us every year, they're on duty tonight. So they may be popping in later on the call, and I will introduce them at that time. But Dr. Shern, while we wait for Dr. Einstein, I'd love to hand it over to you to talk to us about the AdMeTech Foundation and the amazing work that you're doing and everything that's happening this legislative session.
Thank you so much, Representative Giannino. Most of all, I would like to really thank Representative Giannino and Senator Creighton, who have been key long-standing champions of our work in the State House. Thank you for the opportunity you are giving us to conduct the work in prostate cancer awareness, education, etc. I usually prepare videos in case, because we've faced so many technical difficulties in the past during Zoom. So Thomas, if you can proceed with my video. My name is Reina Stern. I'm a physician and president of the AdMeTech Foundation, a nonprofit organization leading regional, national, and global programs in prostate cancer education, research, public awareness, advocacy, and clinical care equity. My gratitude to Representative Giannino for making this 5th annual Joint Prostate Cancer Awareness event possible. The focus of my talk is on AdMeTech Foundation's history and our prostate cancer program, established to lead cutting-edge advances in patient care to bring them to Massachusetts men and eliminate health disparities. History of AdMeTech Foundation and its programs is closely tied with my own professional and personal history. Since 1990, I was head of diagnostic imaging research branch at the National Cancer Institute. In this position, I was leading development of national and international policy and related strategy and programs for the National Institutes of Health, NIH, Department of Health and Human Services, and U.S. federal government. Our priority focus was on the advancement of breast cancer imaging. We created digital mammography, breast MRI, advanced ultrasound, and molecular imaging for improved patient care. We also work on teleradiology for image transmission so that we could bring world-class expertise to underserved, rural, and remote communities. As of early 90s, most women had blind biopsies. Precision imaging made it possible to see where suspected tumors were located and develop stereotactic biopsies where biopsy needles are guided with precision to suspicious areas. As of early 90s, women with breast cancer have radical surgery or mastectomy, where the entire breast is removed. A procedure performed in operating rooms causing physical, emotional trauma, pain, suffering, and deformity of women's bodies. Precision imaging made it possible to proceed with minimally invasive surgery or lumpectomy, where we identify and remove only a part of the breast tissue containing tumors. These minimally invasive procedures are performed in outpatient clinics with minimal complications, pain, suffering, and costs. As of early 90s, many women, particularly Black women, were diagnosed with breast cancer in more advanced stages and were more likely to die. With digital mammography and MRI, all women are more likely to have early detection of breast cancer, critical for saving lives. Today, Black women have a nearly equal chance of dying compared to white women in many communities, particularly in a state like Massachusetts with its universal access to care. In 1996, while our breast cancer programs were well underway at NCI and NIH, I brought together the key leaders of government, medicine, and industry to outline new strategic priorities. This expert recommended prostate cancer as the next priority focus for several reasons. First, prostate cancer is the most common major internal cancer among men. It is as common among men as breast cancer is among women. Prostate cancer strikes 1 in 8 men. Breast cancer strikes 1 in 8 women. Second, prostate cancer screening with blood test PSA was successful in identifying men at risk of losing their lives and in reducing mortality or the likelihood of men dying of prostate cancer. However, men did not have accurate diagnostic tools that would make it possible to sort out if an abnormal screening result is due to false alarm or due to a life-threatening prostate cancer. With no accurate diagnostic tools, many men had either insufficient diagnosis and treatment of aggressive prostate cancer with dangerous consequences, or on the other side of the spectrum, they had overdiagnosis and overtreatment of benign and harmless prostate cancer, leading to unnecessary invasive procedures with related life-altering complications and costs. Third, treatment of prostate cancer, such as radical surgery, was highly invasive and traumatic, leading to a prolonged hospitalization, difficult recovery, and the unacceptable level of life-altering complications. Fourth, prostate cancer is a leading health disparity. Black men are 2.5 times more likely to die compared to white men. We did not see this level of disparities in breast cancer even early in my career in the 80s and 90s. Finally, in sharp contrast to women with breast cancer, men did not have accurate imaging, leading to blind biopsies and treatment. Our work in breast cancer imaging created a blueprint for transforming prostate cancer care and eliminating health disparities. At about the same time in 1996, I had a personal experience that left me shaken. A leading clinical expert in Massachusetts, chosen by me, saw my father and determined that he had a benign and common prostate condition. However, when my dad had an invasive procedure for this condition, he was found to have prostate cancer. I was shocked that a leading expert in a world-leading hospital did not have diagnostic tools to make accurate clinical diagnosis. This experience transformed my professional interest in prostate cancer into a personal mission to improve early detection and treatment of this disease for all men and to reduce health disparities in Black men. If we made a difference for women with breast cancer, we could make a difference for men with prostate cancer. I organized other leaders of medicine, and we approached NCI and NIH, key leaders, in the hope to see an increased government investment in prostate cancer research. Unfortunately, in spite of our joint track record and a year-long effort, we did not succeed in convincing federal government. In response to the lack of support from federal government, by late 1997, we established AdMeTech Foundation with the mission to end blind patient care and create the future of image-guided, minimally invasive diagnosis and treatment of prostate cancer. Since 1997, we have been leading pioneering research that resulted in creation of precision MRI, molecular imaging, and other imaging tools that transform prostate cancer care. In 2005, we initiated a large-scale national public awareness campaign that is Manogram, prostate imaging for men. In 2009, we had the first annual Prostate Cancer Awareness Day in Massachusetts State House and proceeded to create a new model in public education. In 2011, as the result of our advocacy, Massachusetts legislature had set up a historic precedent by recognizing prostate cancer as the central healthcare problem in men, a leading health disparity and public health priority. By 2013, Massachusetts legislature established a prostate cancer program. It started with a research project that was seminal in making MRI a new standard in patient care for guiding biopsies and treatment. Since 2014, we expanded our efforts in public awareness. Over the last 6 years alone, we reached over 71,000 people. In 2016, we established annual global summit on precision diagnosis and treatment of prostate cancer, a medical educational event. In 2021, we launched Prostate Cancer Equity Resource Project, I'll describe later. And in 2023, we created an international working group in minimally invasive image-guided treatment to expedite development of strategy for expedited research and implementation of this new approach to clinical intervention. Our statewide program in prostate cancer created a Massachusetts model of national and global leadership in public awareness, medical education, research, and health equity. AdMeTech is leading this program in cooperation with multiple organizations, including American Cancer Society, leading clinical experts, and branches of the NAACP and Latino Health Insurance Program located across the state. Our primary focus is on high-risk men, Black, Hispanic, and Latino individuals, and all men with family history of prostate cancer and increasing age, 50 and older. The centerpiece of AdMeTech's medical education is annual global summit on precision diagnosis and treatment of prostate cancer. Our summit has been recognized as a seminal event in shaping the state of the art and future vision for patient care. Our summit brings together the key international experts representing every clinical field to review the best emerging clinical practices and research needs and priorities. There is not a corner of the world that has not been represented at this event. The latest 9th annual conference took place only in September 2025, several weeks ago. Our summit demonstrated that early detection saves lives and eliminates health disparities. With early detection of prostate cancer, every man is alive in 5 years. In sharp contrast, with late diagnosis, when cancer is spread outside of the prostate to other organs, only 28% of men remain alive at the same time. Early detection is particularly important for high-risk individuals, including any man with family history of prostate cancer or Black men who are twice as likely to die as white men. In prostate cancer, screening with blood test called PSA is the best tool we have for prevention and early detection, critical for saving lives and reducing health disparities. If we look at the reduction of mortality per year, PSA blood test is the most successful screening tool we have had in the history of cancer. It is important for men to take charge of prostate health. To do that, it's important to know your risk factors, such as Black heritage, family history of prostate cancer, particularly when your brother or father had this disease, and increasing age, 50 and older. You can assure early detection during annual visit. Ask your doctor to discuss if PSA blood test and digital rectal exam are right for you. You need to talk to your doctor starting at the age of 40 if you have risk factors I just described, or at the age of 45 if you do not have these risk factors. Before screening, it is important to avoid exercise or sex, which may impact your testing results for at least 2 days. After screening, you need to ask your doctor if your test is normal or if you need to see a prostate cancer expert for further evaluation. It was interesting to hear at our summit from multiple experts that of all diagnostic tools, imaging has become the game changer for men, resulting in improved diagnosis and treatment of life-threatening prostate cancer, while decreasing unnecessary biopsies and treatment. For example, in this slide, MRI shows prostate cancer lesions and guides biopsy needles with precision. AdMeTech has led research and development and large-scale implementation of prostate MRI since 1997. In 2013, Massachusetts legislature funded clinical trial of prostate MRI, which produced groundbreaking data that were presented at the summit of 2016, about 9 years ago. 6 months later, by early 2017, MRI was recommended as the new standard of patient care prior to biopsy and treatment. Similarly to breast cancer, precision imaging such as MRI paved the way not only for precision biopsy, but also for image-guided, minimally invasive treatment for prostate cancer. Some call it male lumpectomy. Similarly to lumpectomy in women, these minimally invasive procedures remove only cancer instead of the entire prostate, are performed in outpatient clinics with reduced complications, discomfort, and costs, and are expected to replace radical surgery in many men. Our summit highlighted the importance of MRI in Black men who are likely to have lesions in the front part of the prostate that are difficult to find by physical exam or standard blind biopsies performed without accurate imaging. More recently, molecular imaging has been shown to play an important role in staging of prostate cancer, including presence of metastatic spread outside of the prostate and detecting return of prostate cancer after treatment. For example, molecular imaging with PSMA has become available at the Dana-Farber Cancer Institute since August 2021. On the left, we can see a regular bone scan study that shows no metastatic spread. However, on the right, in the same man, molecular imaging shows multiple metastatic lesions. This information is important for selecting appropriate treatment. We are proud to have led research and development of molecular imaging since 2001. AdMeTech's leadership in advanced imaging made it possible for us to help men get access to high-quality MRI and molecular imaging before these important diagnostic tools became available in Massachusetts. Our summit concluded that equal access to high-quality care is the key factor in improving patient outcomes for all men and eliminating health disparities in Black men. It is particularly important now with so many novel diagnostic and therapeutic approaches, ensuring high quality, personalized patient care. Without equal access to these advances in patient care, we will see a widening gap in health inequalities, including survival and mortality. Consequently, AdMeTech launched the Prostate Cancer Equity Resource Project in Massachusetts in collaboration with Mass General Brigham, UMass, and other clinical institutions, with the mission to save lives and deliver high-quality care for all. More recently, experts from Beth Israel Lahey joined us. Supporting organizations include Latino Health Insurance Program and multiple NACP branches located across the state. Any Massachusetts man age 40 and older is welcome to participate. Our priority focus is on Black, Hispanic, and Latino men who are at high risk of prostate cancer, delayed diagnosis, poor quality care, and death. Our goal is to expedite access to leading experts who use the most advanced approaches to screening, diagnosis, and treatment available today, and to support men every step of their medical journey. This program helps men to find an expert for the initial or a second opinion in person or virtual visits. We believe that in Massachusetts, with its leading hospitals and universal access to care, our prostate cancer equity program will be able to eliminate health disparities. Experts of the prostate cancer equity program can address any questions about prostate health, from assessing an individual healthy man's personal risk of cancer longer term, to informing men about all available options before and after screening, biopsies, and treatment. We are committed to supporting men during every step of their medical journey to ensure that no man is left behind or struggling alone. To achieve this goal, we created a streamlined process of patient referral and care, reflecting how doctors involved in this program would like to take care of our families and friends. This process consists of several components. First, AdMeTech Foundation's team collects basic information and match individual patients' needs with the appropriate state's experts for clinical care. Second, a clinical organization designates a patient navigator to expedite a medical visit and related needs, including scheduling, registration, transportation, financial and insurance assistance if needed. Third, if an expert recommends any next steps, AdMeTech's team and patient navigator work with men on the appropriate follow-up, such as, for example, additional testing or treatment. I'd like to provide a few recent examples of how Prostate Cancer Equity Resource Project has been making a difference. In December 2024, Martha's Vineyard NAACP asked us to help an older Black man who expressed a lot of confusion and concerns about his care. AdMeTech staff contacted Dr. Einstein, present here today, at Beth Israel Lahey, who agreed to provide a second opinion. In February this year, this man and his wife had a visit with Dr. Einstein, who provided a clinical consultation and contacted the original clinical care team to ensure a coordinated approach. Next month, in March 2025, patient and his wife described that as a direct result of Dr. Einstein's consultation, they understood their situation for the first time and became clear about the next steps. The second example involves George Brickhouse, who in December 2022 took part in the virtual meeting of the PCE resource organized by Steve Bernard, immediate past president of Brockton NAACP. During that meeting, George expressed the lack of trust in his care and difficulties in scheduling prostate MRI recommended by his doctor. We got concerned, and after the meeting, contacted Steve and asked him to explore with George if he would be interested in our PCE resource. In early 2023, George contacted us, and we suggested for him to consult with Dr. Kwok Ding Trink of Mass General Brigham, who can ensure the best of last care, including high-quality MRI. George has been so happy with his care that he became an advocate for our prostate cancer equity resource. In late 2024, Dr. Trink moved to Pennsylvania due to academic promotion. In March 2025, per George's request, we referred him to Dr. Adam Feldman, another leading clinical expert at Mass General Brigham and our partner at that clinical institution. Emma Coyer serves as a manager of the Prostate Cancer Equity Program. Emma is assisted by Erin Roberts, program coordinator, Craig McClay, patient educator, and other members of the AdMeTech Foundation's team. We serve as your individual patient care advocates. When you come to us, Emma will work with you, our team, Mass General Brigham, UMass, Beth Israel, and other clinical partners to expedite medical visits and address any needs you may have. Together with clinical experts, we empower each man to make informed choices in patient care that are right for him before and after screening, biopsy, and treatment. If you have any questions or need assistance, please contact Emma by phone 617-523-3535 or by email coordinator@admetechfoundation.org. Thank you for your attention.
And thank you, Dr. Stern, for the incredible information that you provide us every year, the resource that you provide to so many of my constituents and men in the Commonwealth of Massachusetts, and for giving us such a great overview of what's happened in the last year. So grateful for your partnership and that you're here. And I'm really excited about our next guest that you've brought us today, who you heard a little bit about during your remarks. Couldn't have been a better introduction. I have the pleasure of introducing Dr. Einstein, David Einstein, assistant professor for Harvard Medical School, attending physician for their prostate cancer oncology program at Beth Israel Medical Center, Harvard Medical School. Doctor, thank you for taking the time to be here with us tonight to talk about prostate cancer awareness, screening, and I'm so excited to hear about everything you're working on.
Yeah, my pleasure. Thanks so much for having me. It's a great event. So I thought I'd talk a little bit about kind of myths in prostate cancer, since oftentimes there's a lot of conceptions out there. People may have heard a lot of things from their brothers or their fathers, or some guy they ran into. So some of the information that people might hear. These are some common misconceptions, and we'll go through each one of them in some detail. And then hopefully there'll be a little time for questions. So the first one is that prostate is very common, but it's overdiagnosed. A lot of guys are going to it and not of it. And it turns out that the two things can be true simultaneously. One is that it's very, very common disease, and the vast majority of people with prostate cancer will not die of prostate cancer. But it also turns out that it's the second leading cancer killer among men. And so it turns out that even a small percentage of people is still a large number of people. And so prostate cancer really is not one disease. It sort of spans a spectrum from very non-aggressive to very aggressive and everything in between. Some people may not need treatment at all. Some people may not be curable, but still may be quite treatable. And we'll come back to that concept. But ultimately, I think that we do want to do a better job of identifying those prostate cancers that truly need to be treated. In the concept of prostate cancer screening is a little bit tricky too. So I think that it is the case that many men do benefit from prostate cancer screening, but we have to be thoughtful about this as well. It doesn't help that the recommendations coming out of different agencies and governments and professional organizations tend to be a little bit incongruous, and so it can be to get through all of this. The bottom line is, to the best of our ability right now, we don't necessarily recommend prostate cancer screening for older gentlemen. It may not always be helpful to diagnose a new cancer, but then in their sort of middle-aged, this is something that certainly should be discussed, and there are some people at particularly high risk over here for whom we might want to start even younger. So it's not a one-size-fits-all recommendation. That's why it's super important to actually have this discussion with your primary care doc or whoever you trust, and sort of talk about the risk benefits. And I think that certainly there's concern that we've underdiagnosed prostate cancer over the last few years. That's led to an increase in diagnoses at more advanced stages. Now, sometimes we think that one thing leads to another, and we shouldn't even open this door, just going to lead to biopsies and treatments and all sorts of problems. And I think there's a number of things that are no longer true about this statement. One is that there used to be an idea that as soon as you detected an abnormal PSA, that would lead to a biopsy. That biopsy might show cancer and go to treatment. Increasingly, as you heard from Dr. Stern, we're actually trying to do this more smart, using imaging. We want to be intelligent at this. And so we want to use MRI to distinguish who does and doesn't need a biopsy. And there are people out there who might have what we consider clinically insignificant prostate cancer, doesn't necessarily need to be diagnosed. Maybe we just follow those patients very cautiously. But for people who have high risk, and over here you can kind of see at the bottom part of the graphic, that's what it actually looks like on the screen to a radiologist. Those are patients for whom we do biopsy, and not only do we want to biopsy the prostate, we want to biopsy that area that's particularly concerning. So this has really refined our whole pathway. Another conception is that if you get treatment, then sorts of problems. Taking a step back, not all guys need treatment, right? And so there are people at the low end of this risk spectrum for whom we actually try to do not treatment, we try to do surveillance. And we try to only treat those patients who subsequently are found to have something that really merits treatment. For other guys, they definitely do need treatment. We try to distinguish who's who. And there are certain side effects of that from both surgery and from radiation. But it is the case that most guys are living pretty normal lives afterwards. And it's the minority for whom we have to think about more interventions to address some of the side effects, which we certainly do when needed. Now, PSA is our best test. It is not a perfect test. And so it's important for people to know that just because a PSA is high or low doesn't automatically mean that someone does or does not have prostate cancer. So there's a whole number of things that do from the prostate that aren't cancer and can still make PSA levels go up. There's also some medications listed here are anti-inflammatories, but sometimes people are on medication for a condition called BPH, and this is called finasteride or dutasteride, and that it actually lowers PSA. So you have to be thoughtful about interpreting that value. So PSA is kind of risk stratify, but just because it's normal doesn't mean you're all set. And just because it's abnormal doesn't automatically mean that you have cancer. And that's where MRIs and other tests can really come into play. Now, cancer is scary. And so many people hear the word prostate cancer, they think it's a death sentence. Or certainly once it's spread or metastatic, it's not treatable. A lot of people were asking this question when President Biden revealed his diagnosis. And it out that we want to do everything possible to prevent metastatic disease. It's not a good thing to have, but it's also something that we do treat as almost a chronic condition these days. Men can live for many years, even with metastatic disease. And these are just some clinical trial data that show that the vast majority of patients are still surviving. Many months and years into many of the tools that we use sort of one after another in people who need that kind of approach. We hope that we can not need to do lifetime of therapy, but sometimes we do need to do this. And with those, we can really buy people some, not only quantity, but quality of life. So another conception might be that I don't have pain, so I can't have cancer. And I would say that the most common thing that we hear from our patients is nothing. So very often this is something that is picked up through screening, which by definition is done in people who don't have symptoms. Now, a lot of guys of a certain age have urinary issues, right? Those aren't necessarily caused by cancer. And it's hard to tell sometimes just what symptoms somebody has, whether they do or don't have cancer. So again, this is where interpreting PSAs cautiously, looking at PSA relative to the size of the prostate, and using a prostate MRI can be very, very helpful. Now, it's much less common to present with symptoms like pain in the bones or weight loss, blood counts, kidney failure. These are signs of a really advanced prostate cancer. And obviously, we'd like to do anything possible to prevent people from developing these symptoms or showing up with these symptoms as their first sign or breaking a bone. I think that many are appropriately worried about eating correctly and exercising, and that might prevent prostate cancer. And I know where that inclination comes from. I do like to tell people that prostate cancer is not your fault. It's not because you didn't eat or eat the right thing or act the right way. It's really something that is mainly aging and bad luck. And so people shouldn't feel like they missed an opportunity by not doing those things. That said, these things can be helpful. In particular, there may be a role in preventing the development of more aggressive prostate cancers. It may decrease the risk of a less aggressive prostate cancer becoming more aggressive. And I think that most importantly, it probably helps patients get through their treatment better if they're really taking care of themselves in regards to cardiovascular disease. Most guys with prostate cancer don't die of prostate cancer, they die of cardiovascular disease. And some of our treatments actually increase that risk. So the basics are still important, and these are things that people can do for their own health, even if they don't prevent you from getting prostate cancer. Now, sometimes patients think, well, maybe if I go for something complementary or alternative, that's going to do a better job, fewer side effects. And most of the time, we actually don't know. A lot of these supplements have not been tested. We don't have good data, so we can't recommend them. Sometimes they actually have been tested. And here's a notable study where they tested vitamin E, selenium, or the combination, and actually found that there was no benefit versus placebo in preventing prostate cancer. If anything, high-dose vitamin E might have slightly worsened the risk. And so you can't automatically assume that just because something's marketed as natural, that it's either safe or effective. Now, I think many men are used to being kind of providers for their family, and they're becoming a burden to others financially or otherwise. I will say for surgery or localized prostate cancer, guys are pretty much living their normal lives. They're not having to take time off work. They might have to do a little bit of time with no heavy lifting. Might be more of a concern for some than others. Radiation can be kind of a logistic, and sometimes just getting in the hospital Monday through Friday, between 5 and 25 days, depending on the nature of the radiation. But oftentimes it's a very quick in-out visit. And we can find places that are convenient to folks. And then hormonal therapy, radiation, that doesn't interfere with your ability to work at all. Financial toxicity. So costs of medical care are not insignificant. When I tend to see this most when people are on expensive oral drugs for more advanced prostate cancer, And we spend a lot of time, in particular with our pharmacists, on trying to make sure that patients can afford the treatments they need and are not stuck with big bills as a result. Finally, a little word about clinical trials. We're always trying to do better, but many patients feel like clinical trials aren't right for me. They might have heard one of these things or might think one of these things. Maybe trials are only when everything else has failed. Then maybe you can start them whenever you want, even if you're sick in the hospital. Sometimes people feel like this is always a new experimental drug that we don't know anything about, or that there might be a placebo or sugar pill involved. You might not know what you're getting, or your doctor might not know what you're getting. Randomization, being assigned one thing versus another. Just to back up on these things, one of these things is not true. The clinical trials we have along the spectrum of prostate cancer, even for guys who are highly curable, certainly there are situations where clinical trials are not a good option. They're too slow to get started, or there's something else medically that's going to prevent them going down this line. New experimental drugs, sometimes we have early stage trials and called phase 1, but oftentimes we're testing things that are quite well known and just being tested in a new way or a new situation, or a lot of people have already taken. It's incredibly rare for us to do a sugar pill placebo trial these days. I don't have a single one in my portfolio at the moment. So almost always people are getting something active. It's also pretty rare for us to do a blinded study. Most of the time, we really know what a patient's getting, unless for some reason scientifically it's needed or is acceptable. But we do some trials that involve randomization, being assigned one thing versus another. But many trials are actually everyone getting the same thing, or everyone getting the same thing plus or minus something else. So we covered a lot of ground here, and I'm happy to take questions on each one of these misconceptions. But I think through confronting the misconceptions, we've also had an opportunity to talk a little bit about where the truth lies and where we are in modern practice. So thank you for your attention, and happy to take any questions. These are some of the resources that I listed. I was actually just coming from the Prostate Cancer Support Group, which meets virtually the first Monday evening of every month. So we're all here to help.
Doctor, thank you so much for your time and for sharing this. As someone who lived with my grandfather when he was going through his treatment, some of the things you mentioned were very familiar and some were so new. And in the last 8 years since his passing, the technology and the resources that we have are pretty incredible. So to hear you talk about some things like early detection and how important that is, but also the new imaging and the new we have that is going to really be life-changing for detection it was very interesting. So thank you so much. I personally don't have any questions, but are live streaming this on Facebook. So if anyone watching does have questions, feel free to comment and I'll make sure to get them to the doctor or the AdMeTech Foundation. And I'll monitor it after too, because people watch after the streams. But I'm going to check real quick now to see if anyone has posted anything. I don't see anything yet, but again, thank you so much for sharing that and those resources, because I know just because no one's asking right now doesn't mean that it won't come down the line. And I know a lot of people reach out to my family personally because of what they know that I've talked about and what we've shared. My grandmother's a 5-time breast survivor. Her and my grandfather both were so lucky to be treated by the Dana-Farber. We're lucky to be in Boston and have some of the most amazing hospitals and research facilities in the world. And I think everything that you talked about is such a great, really way to drive home how important research is, how important our investments in our public institutions like, Brigham, Dana-Farber, and the facilities we have in Boston are to improving patient outcomes and also improving access and research. And I know Dr. Stern mentioned the case study in the Vineyard and the fact that we're accessing men in places where it might be more difficult, in those kind of isolated pockets in our Commonwealth, because, since we're such a small state, I think that we have those islands that are isolated from care, but we do, for those in Western Mass, for the Central Mass, for those in the Cape and the Islands, that care getting into radiation every single day isn't as easy as someone like me in the city of Revere that's 5 miles from the city of Boston. So when my grandparents were going in and out of treatment, we could schedule those visits because it was so centrally located. But if you're living on Nantucket or you're living in North Central Mass, it's going to be a lot more difficult. So thank you again. I don't see any questions. But again, if we do, we'll be sure to reach out to you, and I'm so grateful to have you as a resource.
Absolutely. Yeah, my pleasure. And thanks for all your work. And in particular, I think there's nothing harder than being a caregiver for a family member. It's a really critical part of our team. We can't do anything alone. It's always a partnership.
Yeah. Thank you so much for this opportunity, Representative Janina, and we're looking forward to the next awareness event with you next year.
Absolutely. Anything I can do. And it does take a village. So it takes the support of our family, of our community. And I think it's so important for those watching to know that the resources are there, whether it's your brothers and sisters in the fire service, whether it's a neighbor, whether it's, in my case, my immediate family, which is one big, crazy Italian-Irish family. We were all there for each other, but that network is there and that support there. And if you have questions, don't be embarrassed or afraid to ask. And if you are a loved one or a caregiver watching, don't be afraid to push. Don't be afraid to remind that man in your life that they need to go for their screening, that they need to go for their regular testing, to get their PSAs checked, to schedule all those regular appointments, whether they're in their 40s or 50s or 60s. Early detection saves lives, and we know that. So thank you all so much. I'm so grateful. Dr. Stern, at this point, do we have anything else to go over?
No, I just want to thank Dr. Einstein, and I want to thank everyone who attended this event. And I would be absolutely remiss if I did not thank Thomas and Emma, Thomas Satam and Emma Coyard on our team, who are always here and who support our awareness and equity programs. Thank you so much. I hope you will have a great evening.
Thank you, everyone. Have a great night.
Thank you.
Thank you.